is Mary Kay Koenig. I'm an assistant professor at the University of Texas Medical School, and I am director of the University of Texas Mitochondrial Clinic. The main goal of the research at the UT Mitochondrial Center is to help improve the quality of our patients' lives. We look at their clinical symptoms and we find ways to treat those that are tailored not only to each individual patient, but more specifically to their underlying mitochondrial disorder. The more we learn about mitochondrial disease, the closer we are to finding treatments that are effective and even cures one day.
Hudson has been diagnosed with mitochondrial disease complex 1 by Dr. Koenig a little over a year ago.
Hudson is 4 years old. He is adorable. He was originally diagnosed with autism and was kind of blown off by the other specialists. Since we've started caring for Hudson, we've realized that his major concerns are not his autism. His major concerns are his inability to tolerate food. He's fed exclusively through a tube, and even with the tube feedings, he sometimes has difficulty maintaining his weight and nutrition. We've had a terrible time trying to get Hudson to gain any weight. In addition, he has significant heart disease. He has a large hole in his heart that needs to be closed. Because we can't make him gain weight, he's too small for the surgical procedure required to fix his heart. So Hudson has been in a holding pattern for the last year while we've been trying to make him gain enough weight so that we could close the hole in his heart to improve his cardiac status.
Does Hudson speak?
No, Hudson does not speak. But he makes a lot of sounds.
Okay, can you tell me your name?
Reagan.
This is Reagan, and I'm Joy Rowe. And where are you today? Where are we?
The doctor.
Yeah, we're at the Mito Clinic. Yeah.
Riley and Reagan are twins, and both have significant medical complications. Riley had a hole in her heart that was throwing blood clots to her brain, and she actually had several small strokes that occurred. She was having severe migraine headaches and difficulty with balance. We've since closed the hole in her heart, and she's doing much better now. Reagan, her twin, has autism and epilepsy. So Reagan often has seizures, and she takes several medications to keep those under control. The baby of the family is Rebecca, and she really is the most ill of the three girls. She requires oxygen. She has significant muscle weakness. She has problems with feeding and being able to tolerate her food. She's fed through a tube into her intestines, and she has visual issues.
Why did you come here?
There's just not a lot of mitochondrial disease doctors in the nation, and as we looked at the different options, we just felt like this clinic had the most comprehensive care, that they were really trying to care for the patients and make sure that they had some quality of life and not just research this disease without putting a face to it. The clinic here really loves these kids and wants them to really live great lives, and we appreciated that, and that's what we want for our kids, so that's why we chose to come here.
Really good days are really good days, and bad days are really bad days. I mean,
Eric is a teenage boy with a mitochondrial disorder. His main symptoms have been developmental or cognitive delays and severe epilepsy. Eric has very frequent seizures, and he's actually had 2 surgical procedures to try to bring his seizures under control. He's also quite small for his age and behind his peers.
I homeschooled my children, and with the second one, things just weren't working out like they did with the first one. And I know children are different, but there was just that instinct that there was something.
He was crawling
more.
late, he was talking late, walking late, he was doing everything late. He was cross-eyed, severely cross-eyed.
It's hard to know what Eric's life will be like as he gets older. A lot of people with mitochondrial disorders begin to experience progressive medical complaints as they get older. He may start to develop problems with his kidneys or his liver. He may develop heart problems. he may have worsening of his seizures or a decline in his cognitive abilities.
Don't throw up your hands. It's going to be okay. And there is life with Mito. It's
Good
a
life.
mess, but there's a life with Mito.
The leadership and collaborative efforts of Children's Memorial Hermann Hospital and the University of Texas Medical School has allowed us to bring this clinic to life, finding a place that provided comprehensive care for people with mitochondrial disorders. And through the assistance of the leadership at these two institutions, we've been able to do that.
The thing that we must do for these families is give them integrated, comprehensive care in the here and now, and then provide them hope for the future. We don't want them navigating 12 specialists, 10 different places, and that's why we brought all the services and all the teams together in one location. And it's the only place like this in the southern part of the United States.
What we need right now is we need research dollars. This funding can help expand our knowledge and understanding of this devastating disorder and help us find treatments for these children and their families.
Ready?
Mito is a mess. Help us find a cure.
Mito is a mess.
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 Help us find a cure.
Mito is a mess. Help us find a cure.
Mito is a mess. Please help us find a cure.